Hello everyone, I want to introduce myself. My name is Astuti Ringtias. I'm studying in Poltek Mangunwijaya, a pharmacy study program. Our topic today is mentally illness. First, I will explain you what is mentally illness. Mentally illness is a disease which involves both minds and body. This condition can arise when we feel depression, anxiety, worrying about something, or overthinking about something. Maybe you are wondering how mental condition can affect a person's physical condition. First, one of all, you have to remember that when someone feels anxious or scared, the physical will respond it by showing signs like palpitation, rapid heartbeat, nausea or want to vomit, tremor, headache, or sweating. What causes mental illness? There is no single use for mental illness. A number of factors can contribute to risk for mental illness, such as your gender and family history, your life experience, especially if they happen in childhood, a mother exposure to viruses or toxic chemicals while pregnant, use alcohol or recreational drugs, having few friends, and feeling lonely or isolated. Mental illness can be diagnosed by a medical history, a physical action, and possible lab tests, a psychological evaluation. You will answer questions about your thinking, feeling, and behaviors. Their treatment for mental illness depends on which you have and how serious it is. You and your provider will work on a treatment plan just for you. It usually involves some type of therapy. You may also take medicine. Some people also need social support and education or managing their condition. In some cases, you may need more intensive treatment. You may need to go to a psychiatric hospital. This could be because your mental illness is severe, or it could be because you are at risk of hurting yourself or someone else. In hospital, you will get counseling, group discussion, and activities with mental health professionals and other patients. Case study 12 talk about forced treatment of the mental illness. There is Mr. Mr. FZ and Miss FG had been involuntarily committed to a psychiatric center because they have a mental illness and must have treatment in a hospital as a patient. Shortly, this patient refused to be medicated with antipsychotic drugs, but the hospital forced them to get their drugs with various antipsychotic drugs. Physically, they have a right to refuse to be medicated with antipsychotic drugs. The question of our topic is should the hospital allow mentally ill patients to determine their own course of treatment? In my opinion, the hospital should allow the mentally ill patient to determine their own course of treatment. Every person has a right to refuse a treatment and to get information about herself. In Indonesian law, there is a requirements that must be met in order to make informed consent. And number 1, someone who is physically and mentally healthy. Number 2, someone 21 years old or more. And number 3, someone who is married because they have been considered adults. In that case, it said that patient voluntarily go to the hospital. For treatment, it means that patients still have an awareness of themselves, still have control over them. If they still have families, they can give consent to what action and treatment they will receive. Okay, this is my answer, Mr. Teru. Thank you.